Stop canceling your dental appointments. If you're one of the millions of people who avoid the dentist because you're terrified of getting a filling, I need you to hear this. You are making it so much worse. The longer you wait, the bigger the cavity gets. The bigger the cavity, the more invasive the treatment. And what started as a simple 30-minute fix turns into something that costs you way more time, money, and yes, actual pain. But here's the thing. Most people aren't scared of fillings. They're scared of the unknown. They don't know what's actually happening inside their mouth. And when you don't know what's coming, your brain fills in the blanks with the worst case scenarios. Drills, blood, unbearable pain. So today, we're fixing that. By the end of this video, you'll know exactly what happens during a filling, step by step. And I promise, it is so much less scary than you think. Let's get into it. First, what even is a cavity? Before we talk about the fix, you need to understand the problem. Your mouth is full of bacteria. And no, that's not an insult. When you eat, especially sugary or starchy foods, those bacteria feed on the leftovers and produce acid as a byproduct. That acid slowly eats through the harder outer layer of your teeth, the enamel. Over time, it creates a hole. That hole is a cavity. Here's the scary part. Cavities don't hurt at first. You won't feel a thing while the damage is happening. And that's because the enamel does not have any nerves. By the time you do feel pain, the decay has already reached the deeper, more sensitive layers of the teeth. That's why regular checkups matter a lot. Your dentist can spot a cavity before you even know it exists. Now here's the good news. A filling stops the decay in its tracks. It removes the damaged part of the tooth and seals it up so the bacteria cannot get back in. Simple concept. And the procedure itself, even simpler than you think. Step 1. The numbing. This is the part everyone dreads. The needle. But here's what most people don't know. Before the needle goes anywhere near your mouth, a topical numbing gel is applied directly to your gums. You sit there for about a minute or two, and that gel numbs the surface, so even when the injection comes, most people would only feel a tiny pressure, not a sharp stab. The injection delivers local anesthetic, usually lidocaine, directly to the nerve that supplies your tooth. Within 2 to 3 minutes, that entire area is completely numb. We're talking can't even feel your lip, biting your cheek without realizing it, talking slightly funny kind of numb. Your tooth? Completely offline. Whatever comes next, you will not feel it. This is the single most important step of the whole procedure, and it's the one people fear the most. Step 2. Keeping things dry. Once you're numb, your dentist needs a clean, dry field to work in. Even a little saliva can interfere with how well the filling bonds to your tooth, and the filling that does not bond properly won't last. So your dentist places small cotton rolls around the tooth to absorb saliva and keep the area dry. A suction tool sits in the corner of your mouth doing the same job. It's simple and it works. At this point, you're numb, you're set up, and the real work begins. Step 3 is removing the decay. Here's where the drill comes in. And yes, this is the part that sounds terrifying, but remember, you are completely numb. You will hear the drill, you may feel vibration, but pain? No. The drill your dentist uses is called a high-speed handpiece, and it's spinning at around 400,000 revolutions per minute. Its only job is to remove the decayed portion of your teeth as efficiently as possible. This step can take a few minutes depending on how large the cavity is. Small cavity is quick, large cavity takes a little longer. The dentist is carving out everything that's been damaged by bacteria and leaving behind only healthy tooth structure. Think of it like a surgeon cutting away dead tissue. You're removing the problem so the healthy part can be preserved. Once all the decay is gone, the dentist uses a slower, gentler drill to shape the cavity into a clean form that will hold the filling securely. The shape matters. It has to be designed so the filling material bonds properly and does not pop out when you bite down. Step 4 is etching and bonding. Here's a step that most people have never heard of, and it's one of the most important ones. After the decay is removed, your dentist applies a mild acidic gel to the inside of the cavity. This is called etching. It sounds intense, but it's quick, usually about 15 seconds. What it does is roughen up the surface of the tooth at a microscopic level, creating tiny grooves that the filling material can grip into. After etching, the acid is rinsed away and a bonding agent is applied. Think of this like primer before painting a wall. It is a thin liquid resin that soaks into these microscopic grooves and creates a strong chemical bond between your tooth and the filling. A small light, usually blue, is then shined onto the tooth for about 10 seconds to bonding agent instantly. You won't feel any of this. It's just your dentist working quietly and carefully to make sure this filling lasts. Step 5 is placing the actual filling. Now here's where it gets interesting, and this is the part almost nobody knows about. Before the main filling material goes in, your dentist applies something called flowable composite first. Think of it as a thinner, more liquid version of the filling material. It flows into every tiny corner and groove of the prepared cavity, the spots the thicker material simply cannot reach. It creates a perfectly sealed base layer with zero gaps for bacteria to hide in. That base layer gets cured with the blue light, hardened in seconds, and then the real buildup begins. Now the regular composite resin goes in, a thicker, stronger, tooth-colored material applied in thin layers at a time. Each layer is cured with the blue light before the next one goes in. This isn't a one-shot pour, it is careful, deliberate build, like layering plaster on a wall, because layering is what gives the composite fillings their strength and prevents them from shrinking or cracking over time. Your dentist is also sculpting as they go. They're shaping each layer to match the natural contours of your tooth so that when your filling is complete, it looks like part of your tooth. The whole process typically takes 5 to 10 minutes. By the end, the cavity is completely sealed. The bacteria have no way back in. And step 6 is the bite check and polish. Now at this point, you're almost done. Your dentist will ask you to bite down on a thin piece of colored paper called articulating paper. It marks exactly where your teeth are making contact. If the filling is sitting too high, even by a fraction of a millimeter, it'll feel off when you bite and can cause jaw discomfort down the line. If that happens, your dentist simply shaves down the high spots with the fine finishing burr, and this takes about 30 seconds. Then the filling gets polished, smooth, natural, and virtually invisible. When you look in the mirror, you won't even be able to tell which tooth had the filling. And what happens after? You walk out of the dentist's office with the numb face that will wear off in 1 to 3 hours. While you're numb, you avoid eating, not because it's dangerous, just because you genuinely cannot feel where you're biting. Some mild sensitivity is completely normal for the first few days, especially to cold temperatures. That's just your tooth settling around the new material. It fades on its own. If it lasts longer than 2 weeks or gets worse, call your dentist. And that's it. Start to finish, a simple filling takes 30 to 60 minutes. You spend most of that time just sitting there while your dentist does the work. There's no reason to be scared, and there's no reason to cancel. The only thing avoiding the dentist does is turn a small problem into a bigger one. Now you know exactly what's coming, and knowing is half the battle. If this helped, hit the like and subscribe button because we're breaking down everything in dentistry that nobody has ever explained to you.